Sleep deprivation in general, it really impacts and affects almost all areas and aspects of your life. Hey everybody, so it has been a little bit since I have talked about sleep and kind of what you guys can do at home in order to help improve sleep. And so I want to take this opportunity to kind of revisit some of those things that I know I've talked about in the past, but you know, the way social media is and all that type of stuff and what you see on videos, obviously you don't see a lot of old stuff. And so we're going to talk about some sleep issues and what you can do about it. So sleep deprivation in general, it really impacts and affects almost all areas and aspects of your life. It's going to affect your mental health and mental status. It's going to affect your metabolic health and metabolic status, so increased risk for insulin resistance and things like that. It's going to affect your cognitive capacities. It's going to affect your ability to heal. And overall, it's just going to affect your quality of life. And so obviously, it is really important to focus on sleep. Now, I understand, and you know, sometimes I get a lot of criticism on this. I understand that it is very easy to say, well, get more sleep. And someone who has insomnia is like, okay, well, what does that mean? What do you mean just get more sleep? I can't just choose to get more sleep the way I can choose to, you know, pick up a drink and have a drink from it. It can be really difficult and different for people. And so this is where I wanted to spend a few minutes talking about things you can do, the things that I've seen in clinical practice, the things I've seen personally that help patients the most to improve their quality of sleep and their quantity of sleep. So what I would argue is probably the number one biggest thing is retraining your circadian rhythm, your circadian clock, okay? We have internal clocks in our body that help regulate our varying levels of hormones, neurotransmitters, all this type of stuff. It basically helps run our body in a cycle, okay? Cortisol, which is our awake hormone, rises high in the morning and then it slowly falls off through the day until it gets really, really low at night. And then at night, melatonin rises and then falls throughout the night. So in the morning, we're awake, and in the evening, we are asleep, okay? We can have alterations in this circadian rhythm, the circadian clock of the sleep-wake cycle that results in not enough cortisol being released in the morning and it not plummeting and falling the way it should, and then therefore not enough melatonin rising in the evening. And so you kind of get this state of you're tired through the day because cortisol isn't high enough and you never really wake up, but then you can't sleep because you don't have enough melatonin to help get you into that deep sleep kind of state. And so it's this vicious cycle that really becomes difficult. And so one of the best ways to help retrain your circadian rhythm on the sleep-wake side of the equation is actually modifying and adjusting your exposure to light. So most of the time, we are not getting the appropriate stimulus in the morning when we wake up for light exposure, and we are getting too much stimulus in the evening after sunset because of all the artificial lights we have in our house and that type of stuff. And so usually the first recommendations they're going to make with patients is going to be get outside. So within the first 30 minutes of waking up, get outside and get sunlight on your face. Obviously, don't look directly at the sunlight and burn your retinas out, but you want to be facing the direction of the sun. If you have glasses, you're going to want to take your glasses off. If you wear contacts, it's best to not have your contacts in yet because both glasses and contacts are actually going to block some of the UV lights, and we don't want to do that, okay? So you're going to face the sun. Usually anywhere between 5 to 15 minutes is what I recommend. Face the sun, you can have a cup of coffee, a cup of tea, water, whatever it is you do in the morning, and just get sunlight on your face and your eyes. That's going to tell your body it's morning time. Do what you're supposed to do in the morning, which is increase cortisol production. Now, this is not going to be an immediate that you do it one day and everything is fixed. I'm talking about doing this over a few months. And over time, you can help to retrain your body to understand that morning time means cortisol because there's sun out and you need cortisol during the daytime. Then in the evening, what you're going to want to do is after sunset, you need to decrease light exposure. Now, there's two ways you can do this. And I recommend both ways. The first way is to actually decrease the amount of light that is going to be hitting your eyes. The best way to do that is to turn off at least half the lights in your home after the sun sets. So right now here in Arizona, the sun is setting around 7:30. So after 7:30, half the lights in our home, if not more, get turned off, and preferably almost all of them get turned off, especially if we're just sitting watching TV or doing something that doesn't really require a lot of light. We turn as many lights as we can off. That is going to decrease light hitting the eyes. And when we have a decrease in light hitting the eyes, cortisol is going to drop even more. And that's a signal to allow melatonin to come up. Now, the other way you can do that, and we add this on top of it, is to use blue light blocking glasses. So the blue wavelength of light has also been shown to stimulate that cortisol release. And so we want to, on our phones, our tablets, our computers, and then also glasses, we want to use blue light blocking technology in addition to the full light reduction. So that way you're again reducing the stimulus on the brain, on the eyes and the brain, to say it is now nighttime and you need to produce melatonin. Those two things there, they're the evening and the morning things, are probably the biggest needle movers for most people in terms of sleep. Now, the other things that you can do obviously is reducing caffeine intake in general, but also cutting it off after probably noon, 11 o'clock, 11 a.m., noon, cutting out caffeine. So that way more of the caffeine is out of your system when you try and go to sleep. Exercising through the day. Exercise helps to build up adenosine, and that is actually going to help you to sleep. And then obviously not eating a large meal within a few hours of going to bed. So those are the big things, but there's always going to be nuances for every single person. So if you do these and you're still struggling, reach out to your physician. If you want to work with us, great, but reach out to somebody and talk with them about what you can do for your sleep, because one of the pillars of health needs to be your sleep quality and therefore quantity. And you need to try and focus everything you can on improving that if you're struggling with a chronic health concern and you're not sleeping well. Happy sleeping.